In healthcare, unfortunately, we've taken a step forward, now we're taking two steps back. So a key piece of transformation is make sure you don't devolve.
Hello and welcome to the Healthtech Marketing Podcast, brought to you by Health Launchpad and HIMSS. Hi, I'm Adam Chirinas, Health Launchpad founder and CEO, and your host today. I want to give a big thank you to my partner HIMSS. We couldn't do this without you. And also a big thank you to you out there watching or listening and joining us today. I am so delighted to introduce you today to our guest, Dr. Nick Patel. Nick is a highly accomplished physician and healthcare executive and a well-known expert on digital transformation. In 2021 and in 2022, he was recognized by Beckers Hospital Review as one of the 50 innovative Chief Digital Officers to know. So, Nick, welcome to the show. It's so good to see you again.
Yeah, great to see you again as well, Adam.
Well, so tell us about what you're up to. I know you've launched something new in the last few months, and it's really pretty exciting what you're up to.
Yeah, it's been an exciting last couple of months. After 20 years of an amazing career at Prisma Health, I resigned my position. November 4th was my last day. So first of all, it was great to enjoy uninterrupted time with my family and friends during the holidays, which is the first time that's happened in a very, very long time. It's the first time in my career that I can remember I wasn't on call during the holidays. So that's great. So traveled, had some great fun with the friends and family. And during that time, I've started to think about what I wanted to do next. And it's really a journey for me, right? It's as easy as a knee jerk to go, hey, go work at another health system and be in another executive role, versus to really think about and step back a little bit and look at healthcare industry as a whole and where it's going to be, where it is now, but more importantly, where it's going to be. And so for me, I really started to think through that, and a lot of great people started to reach out. Actually, Adam, after your last podcast with me, a lot of folks reached out when you had mentioned that I was kind of leaving. I was like, what? You're leaving? What's going on with you? And then I finally made a notice on LinkedIn. I got over 30,000 hits for that. And a lot of people a lot of people started reaching out to, see what's next for Nick. And for me, I'm really focusing on three major areas. So one, continue as a fractional leader at health systems. And I'm doing that at multiple major health systems, larger than even Prisma. Mm-hmm. Two, work with the healthcare tech industry in helping really high-performing, successful health tech companies grow even further. So being a strategic advisor, and in some instances, even being a digital transformation officer within multiple health tech companies. And the last vertical has actually been very interested in, and is really a new territory for me, is learning more about venture capital and investments into healthcare. What does that look like now? What is it going to look like in the future? What has the current market space really changed everyone's view of it, right? Where you're seeing the market's really correcting some of these valuations that have been just ballooning and really out of control. So working for VC companies and as well on how do you start to look at your portfolio differently? These companies are multi-billion-dollar VC companies, have all kinds of companies within their portfolio. They could be automated companies, digital health companies, customer relation type companies. But when you start to think of them, they're all point solutions. How do you bring that portfolio together to form a platform that is easier for health systems to look at from end to end and integrate into their ecosystem versus bringing in individualized companies, and which is very difficult. Again, in the market space right now, you probably saw the Kaufman Hall report that most health systems have negative operating margins right now, and it's going to be like that probably through 23 and maybe into early 24. Now, that doesn't mean health systems are stopping transformation or innovation, but you have to think of things differently now. And I think a lot of health systems are looking to consolidate their solutions and even in some instances actually outsource them. So those are some of the things I've been working on. And there's another 2 or 3 pretty big ones that once I'm ready to announce, I will. But for now, I'm trying to stay busy, but not too busy. I've done the
Yeah,
60-hour work week.
that sounds very, very busy.
Yeah.
Just let's break it down a bit. I'm always curious about the different roles, some of the different roles within healthcare systems. And you talked about chief digital officer, chief digital transformation officer, chief transformation officer. Unpack those a bit. What are those? Who are those people? What do they do? What is the background? And what do they do right now?
So it's interesting. So one thing, Adam, I think we might have talked about last time, I was the first physician CDO in the country.
Huh.
And a lot of that came by me learning through him. Hal Wolf talked about at his keynote about new and upcoming roles. And he does this almost every year. And he talked about the chief digital officer role about 4.5, 5 years ago. And then I was fortunate to have dinner with Hal the night before. And he goes, Nick, tell me about yourself. What are you doing? And then I kind of told him, oh, you'd be interested in my conversation tomorrow. And as he was putting the bullet points up there, I was like, check mark, check mark, check mark. All those things are the things where I have passion about customer experience, provider workflow improvement, thinking about alternative care delivery models and on services, rethinking how we actually take care of patients asynchronously versus synchronously, those types of things. So the CDO role really kind of came in more focused on the consumer side. And you probably notice a lot of CDOs are actually not physicians.
Right.
I was one of the few that are. But some people came from retail. Pratt Varma from KP came from Home Depot. Tony from Baptist South Florida came from American Express, eventually from Disney into that health system. So it brings in a totally new, fresh look to healthcare. Then you start thinking about there were actual digital transformation officers. Sometimes those transformation officers could be clinical and thinking about how clinical transformation, right, quality and care delivery transformation versus technology transformation. And then eventually some roles are combining both the clinical aspect of transformation of how healthcare is delivered and how do you use the tech to actually do it and how do those two come together. Now, what we've seen and what I've seen in the evolution, especially in the last, I would say year and a half, actually, I would say the last 6 months, is a lot of CDO roles are folks are leaving those roles and going elsewhere. Pratt went back, left KP, is now working at Target as their head of digital. So much bigger role back in the retail space. And then there are roles that are changing in that CDOs are also /CIOs. I don't know if I fully agree with that because I think those two roles are two different priorities and what they should be doing. One needs to be more consumer focused and innovative and looking at new care delivery models. The other one should be keeping the lights on in infrastructure. And there's an extremely important role as a CIO. There's so many things the health system from a technology perspective has to keep an eye on and update and optimize, et cetera. So I think the role will continue to evolve or devolve depending on how you look at it. But at the end of the day, the key to no matter what the title is to have that role be operationally effective. And in order to be operationally effective, you have to have the right governance at your organization to make sure that role is able to do what they're tasked to do. And unfortunately, sometimes in health systems, people are given the title and no power or no right governance to make things happen. So
that makes complete sense, particularly the aspect around governance. You think about the last 3 years, the pandemic, such a disruptive force, but also such an accelerator. And so it seems like, that particularly a lot of the consumer-oriented technologies like telehealth and chatbots and things like that had a massive acceleration in the first year, 18 months from the start of the pandemic. Now things have settled down in the last year.
Yep.
So it's sort of interesting that you said that some people are going back. Maybe it's like they've just said, hey, my work's done here, or things are slowing down. What do you see as the role of that transformation officer over the next 2 or 3 years? I mean, that's a sort of a reasonable horizon, right? Not too short, not too long.
So transformation in the true sense of the word is something that is improving upon old processes, right? So it's like when you update your OS on your computer, you're improving that function of that OS. You don't go back. You improve gradually over time. In healthcare, unfortunately, we've taken a step forward. Now we're taking 2 steps back. So a key piece of transformation is make sure you don't devolve, that you continue to move forward, not backwards. Now, can you consolidate? Can you outsource? Can you do those things? Absolutely. You should be looking at the bottom line in dollar at all times and what the clinical value of what you're doing is. Not the technical outcome, but the actual clinical outcome, right? So that's one thing that every transformation digital officer, CIO should be doing, is not thinking only tech focused, but pragmatically about how they need to position those solutions to help providers deliver care better. Because at the end of the day, healthcare is about delivering healthcare, not making cars or TVs or anything else. It's producing a better outcome for a patient, period. That's the end of the day. That's what you're up to. That's what you're supposed to do. But I find, just like with COVID, healthcare reacted to a pandemic as it needed to. Made sense. But what we learned during that time is that the services rendered virtually were well accepted by patients. NPS scores were high, no-show rates shrunk, quality improved. But what do we see now? We see that in the early part of 2020 and through 21 to the first vaccine, that we had 80 to 90% of all office visits or encounters be virtual. Then now, on average, if you look across the country, it's about 4 to 5% of all encounters daily. Why is that? Now, some people are doing great. One of the health systems I'm working at is doing 10 to 15, but that's unusual. And so it should be part of weaving into what we learn from that into how we deliver care. So including potentially virtual primary care. Why do we have so many people waiting for a primary care doctor? Why can't we see them virtually to start?
Yep.
Why can't we use our brick and mortar locations, lab rads, and everything else to send patients to those locations seamlessly based on GPS location of the patient? And then the same provider then follows up on the results, just like you came to see me in my office. Virtual care does not have to be just acute care, period.
Where's the resistance? Why is it going backwards?
Part of it has to do with reimbursements. Now, that has not been an excuse right now, right? Under the PHE, which has been in place and extended, I think, to the end of 23 now, they're fully reimbursing you equally as they would if you came into the office. So there is no financial loss on that. Providers are getting the RVUs they need based on E&M charge and leveling, and the health system wins too, right? Reducing no-show rates and making, hopefully, if you do it right, more efficient care delivery. So there's one of the reasons is that people have not thought about how to just transform care delivery in general. When healthcare moves to value-based care, you have to take care of people more real-time and near real-time than episodically, every 3 to 6 months or acutely when they're already sick. So you have to weave in not just video visits. So what we're doing technically could have been a video visit right now, but I need to understand what's Adam's blood pressure, what's his weight, what's been going on with Adam since I saw him last. And I should have all that information as me and you are talking, so I can not only make decisions today, but also historically go, Adam, I've been watching your blood pressure for the last 90 days. It's been going high, and we've reached out to you 3 times, and we've made some changes, and today it's better.
Yes.
Or if it's not better, let's make a change. And eventually, let's just say if you, after you have those wearables, I noticed that your weight's going up because you're a congestive heart failure patient, and I notice your oxygen saturation may be lowering, then I might be thinking that you may be getting into some trouble with congestive heart failure and fluid in your lungs. So then I would have you pull out a device, which they have now, where I can listen to your lungs remotely, with high fidelity, and say, oh, Adam, you have some crackles, which means fluid at the base of your lungs. I'm going to double your Lasix, which is a fluid pill, and we're going to follow you, and I'm going to save that hospital admission. Now, let's say you still get worse, but you're stable. Then I convert you to a hospital at home visit, where I'll have a hospitalist take care of you. I'll have a home health nurse come to you and take care of you and manage you until you're out of your acute phase, and then manage you through primary care through your chronic phase and your transition back to PCP. In order to do that, you have to look at it holistically. And most health systems are not looking at it in a digital continuum. They're looking at it only from one slice of that pie. And if you look at startups, they're only looking at it from one slice of the pie as well. And that's where the challenge is. And you'll see this consolidation of these tools. and platforms to allow for that to be more integrated and more seamless for the health system and the patient.
It's so interesting hearing you describe it this way, because what occurred to me is that, with many of the big technologically driven changes, it's primarily been about changing consumer behavior. Mm-hmm. So, like get everybody using that for everything that they do, right?
Right.
As I put it up, my robokiller's going off. So it's changing, so getting people to change their behavior was the key obstacle to success of most things. Yep. From the way you're describing it, and it makes perfect sense to me, is that the consumer behavior was there because everybody was doing things virtually before, and sort of, they kind of like it. It's easier. I don't have to travel around. There's so many benefits to the consumer. The behavior change is the organizational change. So, absolutely. And it's not just the physicians who are, always, right. Everybody always says, the physicians are the last ones to change. It's not just the physicians. There's so much in the workflow that needs to change for that to happen. So I'm kind of projecting from that. Then the role of the chief transformation officer, as you say, is much more operational, because it's not just about seeing the opportunities that technologies create. It's actually understanding how to go into an organization and get them to change the way that they operate. Is that right? Is that
absolutely? You have to be strategic and less tactical, right? It's not about at elbow fixing one-on-one issues. It's truly being strategic and looking at how do I put up this healthcare OS and integrate that into the care delivery. For me, I was in a unique position. I was also vice chair of medicine. So I made sure that I understood when I'm recruiting primary care doctors, which is very hard, that if you think about future practice development and design, how about if I had providers who were 2 days at home and do population health management and 3 days in the office? That's much better work-life balance. Number two, I can actually incorporate quality as a higher percentage of their revenue instead of the hamster wheel fee-for-service world, right? Incorporating that piece of it. And then providing them the data so that they can actually then make sure the A1C scores and blood pressure and all those things are good. So transformation is not just a digital one. You have to transform clinical operations as well. And that person should be able to partner with a chair department or the CMO or CCO to be able to make sure that they are in total lockstep in that strategy, right? So that's one of the key things. And if you do it right, you can recruit more providers, you can retain them, you can actually see more people, you can actually bring in more revenue. It's all there for the taking. Mm-hmm. But we have to fundamentally change how we think. And most health systems, especially big IDNs, they're very siloed in their governance structure. And so they really need to, instead of thinking of it more enterprise-wide, they're thinking about this medical group in this region versus this medical group in another region versus this hospital in this region. And that's just not the way it needs to work. Every hospital should be connected. Every clinic should be connected. So when a patient transitions out of hospital, they have a medical home to go to, either virtually or in person.
That all makes so much sense. Let's switch track. Let's go talk about technology and innovation. So what are some of the technologies out there right now that you're excited about?
Yeah, there's some really interesting thing. Hewlett Packard is working on some great stuff around what's called microfluidics. So to be able to get a slew of tests done with a drop of blood without getting a vial of blood. Now, you've seen other people try to do this. I won't name it, that big people like Theranos, I guess, and others succeed. But, HP is actually, in the printing business, right? So think about print cartridges and the picometers of how small a print dot comes out of that cartridge. So think of that being actually a blood drop, and printing your labs literally based on results. So those are types of things that some innovative companies like Hewlett Packard and others are working on. I'm seeing some really interesting uptick of use of VR and AR. I'll call it XR to be more accurate in health systems.
What's XR?
XR is really, could be augmented reality. It really stands for extended reality. But augmented is like I'm looking at you, but I'm seeing information around you, but I'm seeing the real world. VR is you're fully encompassed in the virtual world. You're not seeing anything outside of it. Right. And XR is really a blend of the two.
So what are some of the use cases?
Yeah, so if you look at Hoag Institute, my colleague over there, head of neurosurgery, is doing some wonderful work on using VR, where they're actually taking real-time MRI and CT images and doing a pre-op planning by as essentially flying through the brain of how they're going to operate.
Wow.
And then they're
How
using
cool.
that, yeah, and they're using that same image and putting the VR on the mother or child or the patient and showing them, here's what we're going to do. The reason we're not going to cut a hole in your skull over here is because if we go that way, we're going to hit this, this, and this. So they can simulate surgery without cutting on you. And then, so instead of having a burr hole here, they already knew before surgery, don't put it here, put it here. And
Right.
hence avoid. And these are real-time images of the patient. So great use cases in surgical. What they've already shown and published is less hospital-acquired infections, improve less OR time, so more cases coming through, right? Which is makes every CFO happy,
Yep.
and huge improvement in patient satisfaction as part of that.
Yeah, and safety, of course.
Yeah, so there's that.
I've heard a lot of use cases around education and using, for example, like virtual cadavers, right? I mean,
Yep. Yeah. HoloLens is doing some stuff around that. I think they did it with Northwestern, but don't quote me on that. But essentially using that as an overlay over cadavers and being able to look at things in a different way where you can see the anatomy outline. So I think this revolutionized how we're going to educate our students. And then the other thing is using it for end of life palliative care. So imagine putting a patient to their sensory journey, and at the end of their life wants to walk through France, wants to see Paris, wants to go to England, wants to go to Disney World, flying through that area, and putting him in a sensory journey. There's data that shows that if you put VR on a patient post-operatively for hip and knee, they'll actually hit the PCA pump for morphine less, much less. Because you're putting them on a sensory journey and essentially not having them think about their pain. They're going somewhere else.
Right.
So it has a lot of use cases, palliative care. And then how is that connected to 3D printing? So Hoag Institute even will actually 3D print your lesion in your brain and hand it to you, and one-to-one scale. There's another institution that did this baby who had a collapsed heart, ventricle, and they reconstructed this baby's heart, and this baby has the actual one-on-one 3D print of her heart. A great testimonial around that mother and how they're able to do this. So I think that VR is going to play a huge part, or in general, going to play a huge part in healthcare. And then same as 3D printing ears and body parts and knee replacements. Imagine taking a scan of your knee on the good knee, replacing it, inverting it, putting it on the other side, and it'd be a perfect, customized, personalized knee for you, or hip for you, right? Those types of things are going to take off. And so really exciting to see that. And then of course, automation and chat and AI. I know everybody's talking about.
Well, so I want to ask you about that because not a day goes by without some Chat GPT getting in something. So what about Dr. Chat GPT? Is that going to happen?
Yeah, I think that patients are craving education on their healthcare. And right now, it's very two-dimensional and paper and multiple pages of paper that you had to hand a patient, and they're going to throw it away and they're not going to read it. It's not contextual to what they need. So there are companies out there that are using true data, queried observational data across hundreds of millions of records that will actually give you information that's pertinent to you. Not only you as a provider taking care of a 13-year-old with lupus, but and even on the patient side, they can query. I have this kind of cancer with this kind of genetics. What should I be asking my doctor? What should I know about? What's the latest, greatest treatment? What shows the best outcomes, et cetera, right? You can't really do that right now, but there are companies and startups that are working on that or are doing it. Great company actually out of Stanford, Atropos Health, is doing that as well. But yes, I think ChatGPT or AI in general, so long we make sure that we don't introduce human bias into that outcome of that information, which is a very slippery slope because there's always baked in unconscious bias in things. And we have to be very careful about what the AI is learning and how we take care of patients and the data that's coming out.
So there's a credible pathway there. Well, Nick, I mean, I could talk to you all day, but I can't go without asking the question I ask everybody, which is, if you could go back in time, and it could be any time, could be, just give yourself one piece of advice, what would that be?
Don't say yes to everything.
Don't say yes to everything.
Yeah. Yeah.
Interesting. So say no to a few things.
Yeah. Make sure that, you have a work-life balance. Don't burn yourself out. Don't say yes to everything. Because once you start doing things well and they know that you can do things well, they're going to come to you with more and more and more. And you're just going to have to say no sometimes.
Yeah. Yeah. I think, it's interesting. I think that we talked first, end of last year, just as you were leaving. Mm-hmm. And, I would say you look relaxed. You look much more sort of like, you've really, as you say, you've really enjoyed the last few months and had the opportunity to smell the roses.
I haven't had to wear too many suits anymore, which is great.
Yeah, that's good. I haven't worn a suit in ages. I think I've tied one tie in the last, 5 years, 3 years. And I think that was a bow tie for my son's wedding, and that's it.
That's right. Yeah. No, I'm enjoying it. And I'm getting to meet some amazing folks in the industry. And always great to always talk to you as well. And, it's there's a lot of opportunity out there, and I'm looking forward to working with even more partners as we move along. So it's exciting times.
Well, I hope you get 30,000 hits to this podcast, because I certainly would like it too. So it's such a pleasure to have you on the show. And I knew that, you'd have a lot of interesting things to say, and boy, was I not disappointed. So thank you so much.
Thank you, Adam.
Before we go, I just want to let you know that if you're listening, you can watch the video of this, and it's well worth seeing a video of Nick in action. And if you're watching the video, you can subscribe to this podcast on Apple, Spotify, whichever is your favorite podcast player. And so we've got more guests coming up, always looking for new ideas. And by the way, if you like this show, tell 2 people about it. Share a link with them. Just let them know it's out there. So thank you for listening. And if you've got a topic, you can email me at adam@healthlaunchpad.com. So thanks very much for listening or watching.